everyone. Welcome and thank you for joining us for today's NeedyMed special topic webinar, Good Shepherd Pharmacy, Pharmacy for the Uninsured. Before we get started, I'm going to offer a few tips so you can make the most out of today's presentation. First of all, if you do have questions, you can go ahead and type them into that question section. For some of you, it may be the chat section of your GoToWebinar control panel. Just know we will reserve answering questions until the end. If we don't get a chance to answer your question, we'll follow up with you by email. But of course, I will provide the contact information for both NeedyMeds and Good Shepherd Pharmacy, so you can reach out to our organizations anytime you need to. You can also find materials we thought you'd be interested in the handout section of your GoToWebinar control panel. And it looks like I got ahead of myself on that checklist. One of the things I wanted to mention, as you just saw, before I reminded you to check out that handout section, is to please also check out the NeedyMeds YouTube channel. We upload all of our webinars, presentations, and videos to that channel. So if you subscribe, you'll be notified when new content is added and you won't miss out on anything. So with that, I'd like to get started with what is NeedyMeds. For those of you not yet familiar with us, we are a national nonprofit founded more than 2 decades ago by a retired family physician, Dr. Richard Sagel, and his friend, Libby Overly, who was a medical social worker. What you're looking at on the screen right now is our mission statement. But simply put, NeedyMeds connects people to programs that help them afford their healthcare expenses. And we do that free and anonymously through our website, needymeds.org, and our helpline, 1-800-503-6897. If you'd like to learn more about our organization, which I hope you do, please check out our website or reach out to one of our call center experts. Also, check out our upcoming webinars. We do our best to host overview webinars on a monthly basis, which will give you a snapshot of what NeedyMeds is, the resources we have, and how to find what you need on our website. But today, let's get to why you're all here, which is to learn about Good Shepherd Pharmacy. So as you saw, a big part of our mission statement is educating people. And we define that really in 2 ways. One, by educating people about NeedyMeds and the resources we offer. But the second way we fulfill that education part of our mission is by educating our users and letting them know about other savings resources when it comes to their health care, which is why we are so pleased to have my friend and colleague Liz Robinson from Good Shepherd Pharmacy here with us today. So first of all, for those of you that are not yet familiar with Good Shepherd Pharmacy, welcome. You're going to be really excited about all the information Liz is going to share with you. And I just want to let you know that Good Shepherd Pharmacy is also a nonprofit, but they are a nonprofit pharmacy that can help you afford prescription drug prices. Simple as that. Now, my friend and colleague Liz, who's going to talk to us about Good Shepherd Pharmacy, is a customer service expert. She's worked with Good Shepherd Pharmacy since April 2021, and we're so pleased to have her here with us today to share her expertise with the NeedyMeds audience. Liz is going to walk us through what Good Shepherd Pharmacy is all about, the services they offer, and most importantly, how you may be able to save on your medication costs by becoming a member of this nonprofit pharmacy. So, without further ado, and hopefully seamlessly, I'm going to go ahead and pass the mic and the screen to Liz. And as she grabs that screen, I will remind everybody that if you do have questions, you can type them again into that question section or chat section of your GoToWebinar control panel. With that, I'll pass the mic to Liz and enjoy the presentation. Thanks, everyone.
Hi, Carla. Hello, everyone. Thank you for the introduction, Ms. Carla. So Good Shepherd Pharmacy, it is a pharmacy, a nonprofit pharmacy So I will begin with telling you a little bit about who we are and what we're about. So our mission to improve the lives of our members through affordable pharmacy services and the gospel of Jesus Christ. We aim to make medicine more affordable for all, but the reason we call Good Shepherd a ministry is because we're equally concerned for your spiritual health. If any of our members or prospective members would like to impact their spiritual health as well as their physical health, we would be more than happy to come alongside and share the gospel of Jesus Christ. We are a praying pharmacy, and it is our privilege to pray for your physical and spiritual health. So in 2015, Phil Baker, a local Memphis pharmacist, started Good Shepherd Pharmacy, a 501c3 membership-based charity pharmacy dedicated to serving the underserved, uninsured members of the community. Good Shepherd offers members access to a wide range of generic medications, brand name medications, and several types of insulin at affordable prices. Since we started, we've dispensed over 20 million in medication from our donation partners and passed along 7.5 million in savings from medications purchased from our retail partners. Since being founded in 2015, we have grown to over 400 members across 30 states, filling over 10,000 prescriptions annually. We have also expanded the services we offer to include telehealth services, help with patient assistance programs, and the creation of a medication reclamation program called Remedy Chain that takes donated chemo medications and repurposes them to patients in need. For more information about Remedy Chain, we have a separate webinar you can check out, which is also hosted by NeedyMeds. So now we'll take a look at what Good Shepherd has to offer to its members. Our generic memberships covers over 350 generic medications for the membership cost of $25 for 5 or less medications that we fill, and $50 for 6 or more generic medications that we fill per month. So for example, if you currently take 3 generics and they are part of our formulary, your membership cost would be $25 a month. If you take 8 generics covered in our formulary, your membership cost would be $50 a month. For any generics not listed in our formulary, we can provide them to you at our cost with no markup. Our insulin membership is $50 a month. We currently have several different types of insulin available, vial or quick pen form. If our members also need diabetic supplies such as syringes, lancets, or pin needles, we can provide these supplies to our insulin members at our cost with no markup as well. For members who do not have a provider, we have several telehealth membership options that allow for our members to access a provider. For members who only need a provider in the event they get sick with acute illnesses such as pink eye, cold, strep throat, etc., we have the urgent care membership for $10 a month. For those members who need a primary care provider to manage their daily chronic meds and disease states such as diabetes, asthma, high cholesterol, etc., we offer the primary care membership for $20 a month. And then those members who have multiple meds and disease states and need greater attention to their care, we have the chronic care membership, which includes a periodic review of the member's care plan and visits with our pharmacist as well as the medical provider. And the chronic care is $40 a month. So who's eligible? Pretty much anyone can apply to become a member. We do strive to take care more of the uninsured, underinsured, low income, but we can help those that are insured as well. Depending on a patient's status, can determine if they qualify for free medications or if there will be an additional medication cost. So each patient is unique, so each patient's eligibility will be different. If you're interested in becoming a member, here's how it works. If you're interested in becoming a member, the first step is to reach out to us to complete a free, no obligation medication review. You can do that by going to our website, goodsheprx.com, or you could give us a call, 877-521-6337. Based on the medications you take, we will provide a price quote for your membership, along with any additional costs for medications not listed in our formulary on our website. Once we provide a price quote via email, we will follow up with a phone call within a business day to discuss the quote and answer any questions you may have. If we've determined that we can save you money and you're interested in enrolling with us, we will complete the enrollment process and work on getting all of your prescriptions transferred to us. Once we have your scripts, we will synchronize them to our filling and delivery schedule so that 90-day supplies of all your meds fill and deliver at the same time right to your door. And that is all I have, and I do appreciate you coming to our webinar. And again, if you have any questions, please reach out to us by either going to our website or giving us a call.
Liz, thank you so much for that thorough and what I always say is very easy to understand explanation, not only of what Good Shepherd Pharmacy is and what they attempt to achieve, but how easy it is for people to really become a member and save on their meds. And as you guessed, we do have a bunch of questions coming in, and we will get to those. And as promised, I will put up the contact information for Good Shepherd Pharmacy and Needy Meds. But before we get to those, I want to remind everybody that Needy Meds is also here as a source of support if you're having difficulty affording your medications or other healthcare needs. What you're looking at is a snapshot of all of the healthcare savings options we do offer. To learn more about those, go right to needymeds.org. If you'd rather speak with a live person for assistance, reach out to our call center counselors. That number is 1-800-503-6897 and will be up on your screen at the end of the presentation. And as I said, I encourage you to join us for one of our monthly overview Needy Meds webinars. Now, those questions, I see a bunch of them already coming in, but for those of you just that haven't submitted questions yet, if you have anything on your mind, you can do so by typing them into the questions section. As I said, for some of you, it may actually be the chat section of your GoToWebinar control panel. And as promised, I want to leave up that contact information for Good Shepherd Pharmacy. And at the bottom of the screen, you'll also find my email address. If you have any questions regarding today's presentation, it's Carla with a C at needymeds.org. And there's the Needy Meds contact info, needymeds.org. And again, our toll-free helpline is 1-800-503-6897. And for those of you that may be listening in and not looking at the screen, the destinations for Good Shepherd Pharmacy are goodsheprx.com, and their phone number is 877-521-6337. You can also contact them via email if you have any questions. And that email address is info@goodshephealth.com. So let's get to those questions coming in, Liz. You did mention this. This came in, you actually just addressed this later on in your presentation. This was something that was submitted really early on in the presentation, but I'm going to ask it anyway because I think it's an important point to drive home. The question is, what if I have insurance? Can I still become a member?
Okay, yes, ma'am, that's a good question. So, as I mentioned before in the presentation, you can still apply if you have insurance. Please don't let that deter you from trying to apply. If you do have insurance, you just may not be eligible to all of the free medications. There may be some additional costs, but again, there is no markup on those. You will get those at our cost.
That's a great question. I'm so important. It's so important to drive home. I mean, you know, I say it's absolutely worth reaching out to Good Shep Pharmacy.
Yes, ma'am.
Another question coming in. This is a good question, and I bet it's one you get all the time. Since all of the meds, as you said, Liz, are filled on a set schedule, this participant is asking, what happens if I want to join or add a new medication in between fill dates? Great question.
Yes, also a good question. So yes, we do 4 fills a year, February, May, August, November. And if we do have a patient that enrolls as a member in between those fills, we can still fill your medication and get you synced up into our program. So we would do what we call a short fill or a sync fill. We'll send you enough medication to last you until your first full 90-day supply shipment.
Perfect. I figured that was a question you get a lot, and that because that must be something that comes up occasionally. So
Yes.
I assumed that Good Shep Pharmacy would have already a protocol for how to handle that. And thanks to our audience member for asking the question. So as I mentioned, I do try to keep the question. I'm not sure if I mentioned this, but I do try to keep the question segment brief. So we're going to wrap it up with one final question. But if you did ask a question we didn't have a chance to answer, we will follow up with you by email. But don't hesitate to reach out to either Good Shepherd Pharmacy or Needy Meds if you'd like your question answered right away. You can visit our website or reach out to our expert call center counselors at the toll-free helpline phone numbers on your screen right now. So Liz, the question I'd like to wrap up with is an important one. An audience member asked, are there any medications you can't fill?
Yes, so also another good question. So there are some medications that we cannot fill. We do not fill any controlled medications. We are not licensed to carry or dispense any controlled medications, so those would stay at their local pharmacy. We do have some, depending on how fast a patient may need the medication for an antibiotic, if they are okay with waiting for us to fill it and mailing it to them, we could do that. Sometimes a patient may need that antibiotic fast, so sometimes we will not fill those and we'll have them just get that at their local pharmacy as well.
Thank you so much. And thank you to our audience members for participating. And Liz, thank you so much for taking time out of your day to share your expertise about Good Shepherd Pharmacy with Needy Meds
Okay.
users.
Thank
And I
you.
encourage, yeah, absolutely. And I encourage everybody to visit goodsheprx.org and spread the word about it with your loved ones, neighbors, patients, and clients because it really might be the answer they've been looking for. Liz also mentioned at the beginning of the presentation that Good Shepherd Pharmacy also hosts another website, and it's another initiative called Remedy Chain. Remedy Chain is a medication reclamation program. So it's something worth checking out. And we do have webinars focused on just the Remedy Chain program as well. So again, look for those on the Needy Meds calendar of events. With that, we're going to wrap up today's presentation. Check out goodsheprx.org, share it with your loved ones, and make sure to visit their website regularly. Thanks, everybody, for your time, and have a wonderful rest of the day. Thanks, Liz.
Thank you.